Our relationship with the Magee-Womens Research Institute has been in place for many, many years. And more recently, starting in 2015, our trustees decided that it was an important time for us to make a much more significant investment in addressing infant mortality in the region. And for the last almost 7 years, we've invested more than $20 million in the Institute and its partners in order to address what we consider to be one of the most pressing health and well-being issues in the region.
Often funding for science is siloed, with some organizations focusing on supporting more basic laboratory research and others on clinical initiatives. And that can be really problematic because it forces science to be more niche and less holistic than it should be. When you have a funder that is open to supporting multiple types of research, it allows scientists to think outside their lane and collaborate more effectively with experts from different fields and explore all those connections simultaneously.
The Richard King Mellon Foundation has expanded their support to broader programs that span clinical programs at Magee-Womens Research Institute and a service project at Magee-Womens Hospital, and the ones that link those two together. The ability to integrate their views about the role of science in promoting health, promoting wellness for populations with support for better environment, support for better nutrition, support for better life in people's communities. The integration of these different components into meaningful impact for society is just admirable.
The funding of research initiatives through the Richard King Mellon Foundation has been really integrated in our collective missions to expand knowledge for optimizing pregnancy outcomes for women and their babies, and for us to manage and monitor population health in really innovative ways.
The Richard King Mellon Foundation allowed us to launch our biobank connected to our mommy database. So for the first time, we are enrolling women early in pregnancy and collecting biospecimens along with their clinical data. Having these resources really enable our work to move forward and propels work across the country to really study pregnancy health.
The funding from Richard King Mellon has given, for me personally, the ability to oversee this project with our birth doulas. We have grown very quickly over the last 11 months because of the grant funding, and knowing that we can continue to grow this program has been really instrumental for us. We know that there are a lot of high-risk populations out there that need this type of support that we're hoping to continue to build.
We're trying to develop a nasal spray product for prevention of SARS-CoV-2 infection. The support that we received from the Richard King Mellon Foundation actually helped with some of the initial development work of the nasal spray itself. It also supported some of the characterization for the product. Without the funding from the Richard King Mellon Foundation, we would not be positioned to be moving ahead into the clinical trials.
The Mellon Foundation has really allowed us to partner with incredible individuals to do things that we normally couldn't do on our own. And we are really pleased to have this opportunity to work with them and the Mellon Foundation because we know this is going to have an incredible impact on infant mortality in Allegheny County.
The role that the R.K. Mellon Foundation has played both locally, nationally, and internationally is that it has allowed us on the translational research side to find new discoveries, but importantly on the clinical side to then implement some of those findings. And it's provided a key continuity funding source that has enabled breakthroughs and taking things from the lab out into the community.
They're our major supporter of the Summit and the Magee Prize. They understand the role of innovation in creating impact for not only generations of people today, but future generations, not only here in Western Pennsylvania and Pittsburgh, but around the globe. Without them, I don't think that we would be able to do many of the things that we do here locally. It's really been a pleasure and a privilege of mine to be part of this Pittsburgh community that is weaving together solutions for the rest of the world. And Richard King Mellon Foundation is certainly a driver of that.
All the partners, the foundation, many other foundations in Pittsburgh as well, the Magee-Womens Research Institute, the UPMC hospital system, and their willingness to commit to this issue and other issues that support quality of life for women and children. These are the types of dedicated relationships that we need to have in place for the work that the foundation does to succeed. And so we are so thankful for the fact that we get to be just a small part in this larger story of trying to affect the quality of life for women and children in this region.